Now, in this video, we're going to look at how we can ask about cancers in a more transparent way. So, obviously, there is a balance to be judged between not overly worrying a person unnecessarily while being open and honest about what we're doing. Now, generally speaking, not being open with what you're doing and allowing the patient to have to guess why you were asking the questions is going to cause more anxiety than being open. Having said that, there is almost certainly no advantage at all at spontaneously, unprompted, coming out with a statement such as, "Have you had any symptoms of bowel cancer recently?" You could ask, "Have you had any symptoms of sinister or more serious conditions such as unexplained weight loss in the last couple of months, or any blood in your stools, anything that's really worried you?" So it's like a concerns question, but rather than saying, "Have you got a diagnosis in mind?" you're probing for symptoms that might be worrying a person. Now, if the person has any of those symptoms, you're going to be probing that symptom, and it will be fairly obvious as the consultation goes on that those were serious conditions, even if at the start you didn't state this is a serious condition. So there is I think much better to be open from the start with that. If the person doesn't have any of those symptoms, then the fact that you stated these are serious conditions, you don't have any of them, that's going to be reassuring for the patient. The time to openly ask about symptoms of serious conditions is if the person has come out with that as a concern, either unprompted or because you've unveiled it as part of your ICE questioning. So if a person says, "I'm really worried that I might have bowel cancer," that is the time to start asking why and probing further. Don't park it for later or ignore it and just keep going with whatever your normal model is. You need to probe that immediately. And I would advocate trying to start off your probing with some kind of either positive or empathic statement. So a positive statement would be something like, "Well, thanks very much for letting me know. That's really important you told me that." Or empathic, "Well, that must have been really scary for you," and then you would go on to the probing. So two parts of the probing I would suggest. One is you're going to be looking for symptoms. And then the second is, particularly if there were no symptoms, is how did that health understanding come about? What was the health belief? Was there something seen on telly? They've spoken to someone. So, well, thank you very much for letting me know that. That sounds a very scary thought. What symptoms did you have that made you think you might have bowel cancer? Oh, okay. So that's reassuring then. So you didn't have anything that you were worried about in particular. What was it that made you thought about it then? And something along those lines, we'll start probing, because it's very important you find out about the symptoms that they worried about and why. So I hope that makes sense. And yeah, so remember, get right onto those. Anything the person says, start probing. And I'm sure I'll be doing an ICE sort of base video at some point.